The following portion of Daytime is sponsored by Millennium Physician Group.
A recent survey from AARP found that the top health issues older adults are concerned about right now are mobility and memory, more so than chronic health issues like diabetes and heart disease. Here to share insight on the results of this survey is Dr. Patrick Murray from Millennium Physician Group. Dr. Murray, welcome. Good to have you here.
Thank you very much for having me.
So in this study, they cited loss of mobility and memory as their top concern, more so than chronic illnesses. Do you agree that that should be more of a concern?
I definitely see it a lot with patients in my office. So commonly people are really, as they get older, worried about their independence. And so being able to think clearly and also being able to take care of tasks and do everything they want to do, moving around is definitely valued.
So let's start with memory. If we have somebody in our lives who's maybe going through this, or we're worried about this ourselves, what's some advice that you can give regarding memory?
Gotcha. So first step would be, one, obviously staying active. Activity and exercise we know definitely helps. Making a healthy dietary choices, controlling other diseases they have like hypertension or diabetes, but the most important thing is checking in with the doctor if we're worried about any memory issues or developing any. And during even like Medicare screenings, we can actually do screenings for dementia in that office visit.
And are there supplements that should be taken if you're concerned about memory, something for the brain?
So there's not necessarily one we know for sure that's the most effective. If there's any like vitamin deficiencies or concerns with that, we can always check that at the office and then give you recommendations based on that. But there's not one hard and fast supplement at this point we know for sure. Okay,
let's talk about mobility. We want to keep moving. We want to stay independent as long as possible, of course. What's your advice?
So my advice, obviously, if you're concerned whether it's developing issues like pain issues that limit your ability to exercise or move, if it's issues with osteoporosis, things like that, getting in with a doctor to actually get screened for these kinds of issues, make sure we're not missing any reasons why you're not able to stay active and do the things you want to do. Then we can kind of guide you on safe ways to get back to activity.
Do you find that most people are hesitant to see a doctor because maybe they chalk it up to, oh, there's probably nothing they can do? Like, unless it's a serious symptom like a cough or an obvious physical problem, do you think a lot of people say, I'm not going to bother?
Yeah, and I think some people also have a certain expectation as they age that, oh, if I age, you know, there's some things that are just going to happen that are going to be declining, and I'm okay with that. And so certain things are common, but that doesn't mean that's things we have to accept, and certain things we can keep working on to get better.
So do you have any other advice regarding these two top issues?
Big things also on top of that is maintaining healthy sleep habits and making sure that stress levels are down. If we're worried about things like depression, anxiety, those will also impact your ability to be active, think clearly. So if those things are also effective, come and see your doctor and we'll try to help you with that too. You
always read though that you just don't need that much sleep as you get older. Is there a recommended number of hours?
We still try to get ideally 7 to 8 hours and stuff. Obviously sleep has major changes as you get older. We're lighter sleepers for sure. But we want to make sure there's not other issues impacting it, things like sleep apnea or other issues that are possibly limiting your ability to get good healthy sleep.
Your health is in your hands and a doctor can help a lot. I think that's the takeaway for all the segments that we do with you. Some people don't realize how much the doctor can help, and that's what they're there for.
My job is to try to see and help as much as I can if you have any concerns. Even if you don't have ones that are obvious, see if we can just touch base on those things and make sure you're doing well.
So good. Dr. Patrick Murray, thank you. Appreciate your time.
Thanks a lot.
You're welcome. And if you would like to find a physician or schedule an appointment, you can visit millenniumphysician.com. Daytime will be right back.
The preceding portion of Daytime was sponsored by Millennium Physician Group.